welcome to our NHS public meeting. We believe that politics has to come from the people and should be speaking the people's voice. So tonight we are addressing the urgent issue of our NHS.
I worked in the local NHS for more than 30 years as a nurse and a health visitor. After the coalition government came to power in 2010, there was an increased ideological attack on the NHS and its founding principles. Since 2012, private firms that have got contracts within the NHS have made £6.7 billion in profit. £6.7 billion in profit. They have made £10 million a week from taxpayers' money.
Wow.
It's utterly shameful. And number two, the NHS needs to be fully and properly funded. And despite what the Tories are currently saying, the funding of the NHS has not kept pace with inflation, and we are currently way below the European average. The first time in 100 years, life expectancy in this country is falling. And as a nurse, as a public health nurse, that's just utterly shameful.
I've been working as a GP for over 20 years and locally in Mile Oak, which is just up the road, obviously within Tanushka's constituency, for the last 9 years. What does an ailing NHS look like for those that work on the front line? Well, let me tell you. It looks like waiting lists for up to a year to see a specialist. Locally, the waits for ENT, neurology and gynecology are over a year. So like any good patient, once we've established that we're not well, we need to know what is the cause? How have we come to be sick? And as Claire's quite clearly outlined, there are good, solid reasons that explain this sickness. The first is our NHS has been chronically underfunded for over a decade. There is simply not enough money going into the system. As again, Claire outlined, increasing numbers of NHS patients are being treated in private sector or private hospitals. Locally, the Montefiore sees the easy operations. We know these organisations cherry pick the easy, straightforward young patients, the arthroscopies, the gastroscopies, the complex patients, the elderly patients who require significant and complex care that is risky are left to be managed at the Royal Sussex County, and these private hospitals just laugh all the way to the bank. So, what's the cure? To me, it seems simple. First and foremost, we need proper long-term investment. That's investment in workforce, training, supporting clinicians, retaining clinicians. We need to give the NHS appropriate sustenance that it needs. Like a child, we need to create the conditions for the NHS to develop, grow and flourish. We need to remove private corporate providers from the NHS. We do not want or need shareholders to profit from our NHS. I would argue that to nurse our NHS back to life, we need to remove those parasitical corporations from the organisation that's the NHS. Lastly, and the reason that we're all here, is we need to elect leaders, we need to elect MPs who truly believe in the NHS, who don't just give lip service. We need MPs who understand what the NHS needs, and that's why I'm going to hand you back to Tanushka. I believe that Tanushka, if elected, can help bring our ailing NHS back to full health.
Managers see people as an economic burden or people who can be monetized for private companies. The idea of actual care in healthcare is being really diminished. And it actually brings me a lot of the time to tears because I cannot provide a service for my patients. And then we think about all the social issues that go on in people's lives, the senses of loneliness, isolation, post-pandemic, the levels of anxiety that have got through the roof, particularly for our young people. CAM services are stretched beyond belief. Nobody can get a diagnosis for their children for autism or ADHD, and their children are there at school. They've got a certain period of time where they can be helped, and these children are on waiting lists for sometimes 4, 5, 6 years. They go to the private sector, those who can afford it. But those who can't afford it, their children then have 2 tiers, ones who get the help and the ones who are impoverished already cannot get the help that their children need, and a cycle starts to set up. Why is it that we can find all this money for wars? Why is it we can find all this money for surveillance technology? Why is it we can find all this money for detention centres? £44,000, I read today, per person in a detention centre for a year. Why is it all this money is available for private companies and private contractors? Why is all the money there for managers? Their level of pay is unbelievable and often about 10 times as much as the carers. Why is there all that money, and why is there no money for us to care for one another?
Couldn't make it more clear that what we're going through, austerity, is an ideological choice. You couldn't have made the argument more clearly. Thank you so much. And it's so important to really, really look into mental health, both how we treat it and how our society causes, our sick society causes mental health crisis.
It's quite easy for NHS to work with the community, to either organisation. They don't have to be like top-down approach. Always listen to your community. What are they saying? What is the needs? And really listen. And the training of the staff is so important. The cultural sensitivities, the barriers. We want to talk to you. Why are you not listening to us? Hear us. Hear our voice. So that is really important, that the communities are heard, the voices are heard, and that we overcome any barriers.
It's really important that we mix and that we talk and that everyone has their voice, gets to exercise their voice.
Putting care, not profit, back at the heart of the NHS. Put an end to the corporate profiteering of the NHS. Yeah.
We also looked at integrating health and social care.
Social care and healthcare and acute care are interrelated, they're linked. So inequality in wealth, poor housing, poverty, all contribute to poor outcomes ultimately when you get to a national health system of any sort. So we need to kind of address the issues of that. So it's not just about funding the NHS, we need to be looking at the wider issues of wealth inequality.
What we want Tanushka to stand for is to represent the big imagination for moving away completely from business, corporations, money being the driving force. We want to go back to care being focused centre. And that seems so far away that we need you to really keep pushing for that big thinking. It's possible for us to change our world in the way that we know should happen, and we need people like you to hold that out and keep that vision of moving that way, because all of it's over here at the moment.
I've learned so much, and that's the whole point of the campaign, to educate ourselves through each other. So should we just finish by giving everyone who attended, listened, contributed, and volunteered a round of applause, and to the film crew and to Unspun for hosting us. Thank you.